I think actually it's important for us to recognise that now is possibly the most important time to be tackling things like health inequalities in our communities, and delivering on the prevention agenda within our communities, in order to sort of be able to press reset, get us to a better position as a health care and well-being system. We need to shift our resources and shift our effort away from managing people who are in difficulty to a position where actually we're preventing people from getting into that position at all in the first place. Anyway, that's enough of me wittering on. We've got 3 sessions today. The first one is talking about 5G, the opportunities of 5G, and we've got John, I'm hoping I'm going to pronounce your surname correctly, John Vesey. You can correct me in a minute if you wish to. Who'll be talking about the opportunities around 5G. And then later on, we'll be having a presentation around something called the Baton of Hope. And then there'll be an update from the Policy Commission later on in the afternoon. So I hope that's to everybody's expectations. With that, do you think I can hand over to you now, John? Are you there?
Yeah.
Did I pronounce your surname correctly?
That's one of the pronunciations. My family goes with Vesey, as in easy, cheesy, and various other rhyming words. But yeah, I know other people that have the same surname that pronounce it exactly how you did. So I'm not that precious yet. We'll see. Thank you very much to you and to Alex, and for all of you on the call. So I've got some slides to run through. And obviously good to see some familiar faces, but yeah, happy to take questions during, but I know that there'll be also some Q&A time at the end of my presentation, so feel free to post things in the chat. I will try and keep up with those as well. All disappeared. Where did you go?
I can see your slides. Can everybody else?
I can.
Yes, we've got nods. Good.
Perfect. All right. So yeah, so today I'm talking about the benefits and challenges of connecting across systems, and as part of that, I felt, as preparing the slides, there are a number of areas where I already fall down on that myself. So I thought, in the spirit of transparency and honesty, I better come with that in mind. So yes, in my background, spent a bit of time as a civil servant, a bit of time working for Amazon, and then since then have focused on working in research and technology organisations, looking at where can technology of different shapes and flavours offer support to public sector organisations. So spent quite a long time with one of the catapults. I'm now at WM5G, which was born out of the West Midlands Combined Authority, initially to focus on 5G, hence the logo and the name, but since then it sort of expanded its remit to look at connectivity more generally, and myself and a colleague, Jane Rook, were hired to look after what we can do in health and care, and originally that was just across the West Midlands, but again that has changed, and so we'll be updating that as well to make sure that it covers a broader remit, so it's not just West Midlands, it's not just 5G. Apart from that, the logo is absolutely fine. But yeah, so my background is about trying to support yourselves and others bringing expertise together, and making sure that learning is shared across those across those projects, rather than trying to repeat pilots or projects. We've seen lots of places where 4G or 5G have been trialled, and it feels like a bit of a shame when it then gets repeated as a trial in a neighbouring area, whether it's a neighbouring local authority or a neighbouring trust or ICB. And for me, another big thing, and this will be part of the medicine that I'll be swallowing, hopefully, is a big part of what I want to do is to understand how the systems work to start with. And Chris gave a really good review from where he was seeing challenges among his organisation at the moment, and like he said, I'm sure it's common across lots of organisations. but to understand those systems, that's the starting point to then potentially redraw some of it. And it's no surprise that connectedness is important to me. Some of that is digital connectivity like 5G, others is bringing groups together. So we'll go from there. So just a bit of background about WM5G. We have these missions on the left-hand side, and at the time we were trying to align them to the overall missions of the West Midlands Combined Authority, which are on the right-hand side. And so one of the big ones has always been, and we've got a connectivity team that support it, making sure that everyone can benefit from connectivity so that it doesn't, in our area, exacerbate health inequalities. So the aim is that it becomes social determinant of health in the way that I know that the Lancet talked about in the last year or two, where it could be seen in that light. That is the mission. But first, I guess, reality check is we're quite a way off that. So WM5G last year was independently verified that the West Midlands has the best 5G connectivity outside of London, but it's still way short of what it needs to be. So these three images, the first is 4G coverage for Cov and Warwicks, 5G coverage by spots in black in the middle, and then on the right hand side is fibre coverage for that particular patch again. And as you can see, as I'm sure you all experience in your own locations as well, it's not consistent. And even on the first map, that's 4G coverage of every single provider overlaid on top of each other. So as individuals, we're only ever with one provider. And so you need to have the map of that. But for me, this is where a lot of our work often starts. It starts with what is actually your connectivity base, where are you starting from, and what does that allow you to do in terms of offering services closer to home, offering more of a join up between health and social care, where people are spending their lives and where people want to spend their lives, rather than saying we can only offer these services because John and team haven't bothered doing connectivity properly and haven't offered it as something that is continuous. So overall, our vision is about how can connectivity generally, not just in 5G, deliver great care closer to home. And the reasons that we look at that are twofold. One is about how do we support systems to deploy some of that. And as I said earlier, that's about understanding the current context, the status quo before suggesting and then potentially working through some of that change. But we also recognise that there's a key enabler in terms of making sure that wherever we're doing those changes and deployments, we're allowing others to view it and be involved in it as best they can afford to be. And so for me, as it says on the slide, the ability to connect across those systems is essential, so that we're making sure that if we're doing a trial in Derbyshire, why shouldn't the rest of the Midlands hear about that? And vice versa, rather than needing to do it at Derbyshire and then take it to Nottinghamshire and various other places. And so we've done that with the view that, you know, officially that is what the vision says. I think we are obviously acutely aware that actually it's not really the full story, and the connectivity actually only helps deliver great care closer to home, and it's such a small slither of everything else that needs to go into what does it mean to deliver great care closer to home. So we need to update that vision so that it is connectivity helps deliver great care closer to home, rather than often you'll see, and I'm sure you've seen it before, tech companies pretending that it will be their piece of tech that will solve that problem. So we've looked at connectivity in the past and obviously focused on 5G and said where do we think it can support in different areas, and try to look at across the gamut of prevention through to emergency response, long-term conditions, and the other bits on this slide. And then we've got some examples of that at the bottom. So we've done pieces in COVID where we've allowed GPs to have remote access to patients with ENT cameras and other capabilities. We've done capture endoscopy in Coventry and Warwickshire. We've done work with IoT sensors in the backcountry, but all of those have been small scale trials. And there's no pretending about that. They have been tests and demonstrations of connectivity with a view to health outcomes, but it's a view with if they're scaled, if they're adopted at scale rather than anything else. So yeah, plenty of examples if you want to talk through those. Happy to do that, but recognise that the challenge still remains. How do we actually scale some of these things rather than keep inventing a new piece of tech to wow people with, or to look shiny for people to cut ribbons in front of. So in terms of the system thinking and deploying, we've looked at a number of areas. I know that there's some real interesting examples across the Midlands as well. In terms of these different pieces, we're not wedded to a particular piece of kit. We're agnostic, so happy to support people assess different kit. So I know that we've worked with Seb and team before at the CoLab in Herefordshire and looked at a range of kit that's on capability. We're talking to Stratford about doing similar events with them around remote monitoring tools and being able to assess them in parallel rather than necessarily needing to embed all of them. So happy to do that if that's useful. But before I move on to the other area of work that we do, I thought I'd throw in a quiz. And given the numbers of people on the call, maybe don't shout out, please. If you could put any suggested answers in the chat, that'd be great. So it's a rather long quote, but I'll let you guys have a quick read, and then you can have a guess, and I'll give you some pictorial clues as to who it may or may not be. If someone can give me a thumbs up when they've had the chance to read it, then I'll. Lovely, thank you, Mark. So those are some of the health secretaries. I'm sure some of you have experienced at least one of them, possibly, maybe more. Any guesses? Oh, all right, they're coming in fast. Okay. So we'll let the guesses keep coming because we've got a second question in the quiz and a third quote as well. And I'll give you a clue, it's none of the people pictured on this slide. Yep, so it looks like the cat's out of the bag. These are all three quotes are from Patricia Hewitt, and these last two are coming from the Hewitt Review. But it's interesting for me, at least, to see all three in parallel, because I think it's about how do we do things more locally, how do we help ICBs despite the dramatic 30% cuts again being felt. How are there ways in which we can help those organisations be conveners, be anchor tenants, like the long-term plan talks about. We all know that integrated care sounds right or sounds sensible, but how do we support it when we've got these cuts, we've got these workforce challenges, we've got all the things that Chris was talking about facing us, and how do we convince frontline staff of the benefits of some of the big changes that we're going to have to deploy as well. So I talked earlier about our overarching vision and the fact that we've got some examples of deploying some technology, often with 5G, but not exclusively. But wanted to also talk about the right-hand side of this diagram as well, about some of the stuff we're doing around system learning and sharing. So part of that is because of conversations with colleagues of yours, as well as with local authorities, where there has been a desire to set up a learning network to bring together some of the teams across the Midlands, but also across wider patches. My colleague Jane Rook used to run the learning networks for the Global Digital Exemplars, and one or two of those networks are still going and are wanting some additional support. So we are looking at supporting those. We're just going to be there to coordinate and be the secretariat for those. They're not our learning networks. So if they're needed by the systems, we'll happily support them. If they're not needed, because there's other mechanisms, NHS Futures or other learning networks or skills development networks, then there really isn't any point us repeating those things and creating an alternative. So what we're trying to do is bring people together, make sure it's a safe environment for discussion and highlighting what's really going on within a system, rather than necessarily what you feel like sometimes you might have to say in front of a CQC or equivalent. Making sure that it is a regular set of meetings, sometimes face-to-face, often virtual, and it's about showcasing across areas as well. So we are launching that on the 29th of June, so very soon, but happy to share the invites. It will be at the Steam House in Birmingham this time, but it will be an annual event with, we think, quarterly specialty groups. But again, that will be defined on the 29th. So if they want to meet more regularly or less regularly, that's up to them. And then we'll be again offering things like masterclasses and working groups on certain topics, or bringing in certain suppliers if we recognise that there's a groundswell of we're all using System 1. Why don't we all get together about how we use System 1 and how we make it better, or how we get rid of it? Totally up to you. It's your learning network. And we will create a platform that is accessible to both local authorities and NHS colleagues to host a lot of the collateral and information. You could obviously add yours to it, but again, don't want to repeat things. So if you're already storing stuff elsewhere, it'd be a real shame to then have to copy and paste it over to somewhere else. So we'll keep that in mind as we develop things. But yeah, I think for me, it's come about because there's interest in it, albeit small to start with. So happy to see how it develops over time and test the waters. I think there certainly seems to be an interest in having a bit of a horizon scanning function around what technology is on the market, what's already being deployed in places, and having some honesty between colleagues, albeit in slightly different email domains, but still colleagues nonetheless, sharing about what worked really well with that piece of tech, what worked really not so well, and where's the middle ground between those two things. We did some work recently with Swift, where we were talking about actually some of the challenges of the tech they were struggling with weren't exclusively the tech's fault. There were some big bits of the tech that were its fault, but some of it was tech that they were actively encouraged to take on through COVID, and there were challenges around, it felt like it was something hoisted on them rather than something they'd chosen to go out with, and therefore interest from colleagues was certainly lower. And so having these learning networks be a chance to share information about those technologies, talk openly about what's working, what's not, and then hopefully not having to also go through the same trial, allows it to hopefully be quicker uptake. And then a few colleagues, certainly across the local authorities, have said just being able to understand what's happening elsewhere would be really useful. One particular local authority said just being able to understand what's going on in my own organisation would also be kind of useful. So that's part of the aim of where we want to get to. But again, like with the last topic, there's some reality to it. We've mainly focused around a couple of local authorities and quite heavily on NHS trusts. We don't have in the learning network a big bit of the public's voice. We don't have a big bit of the user's voice from those on the receiving end of the technology. We have a lot of the users that will be either the healthcare or social care professionals, but not on the user side. So we know we've got gaps. We need to improve on that in terms of the learning network as it sets up and sets out. And I think we also need to make sure that, you know, that's a regular piece, and that we're not, you know, creating it just for the sake of creating it, that we're not repeating voices from other events or other networks. And then I guess the final bit that we're trying to balance is making sure that we're facilitating and not dictating agendas. Just because we like 5G doesn't mean everyone else has to like it or use it. And so, yeah, that's kind of where we're up to with it. We've obviously seen, I don't know if you've seen the Neil Crowther blog where it talks about some of the challenges about what we value and where does social care fit into that piece about, you know, the quality of the rest of our lives. I think that's a really important point to come back to. But yeah, just to finish before coming into Q&A, this is what we're doing at WM5G. We're wholly owned by the combined authority, so we're looking at how do we support the public sector, whether in the West Midlands or further afield. Sorry, that should have appeared at the same time. And we know that connectivity has a chance to help deliver great care close to home, but it's only one part of the puzzle. We need to work with you guys and others to make sure it's embedded in a way that it's sustainable and also useful for staff. So we're trying to do that through being able to provide those sorts of maps and those assessments of where is good connectivity, what would be a recommended mobile operator if you're in a particular patch. We can do that, or we can recommend others that can do that. We've demonstrated some examples, but we know there's plenty more in all of your areas too. And then we've got some learning networks happening 29th of June in Birmingham, and I'll work with Alex to make sure that gets sent out as an invite after this. That's my final slide.
Thank you, John.